In this video, you'll learn tips to treat nausea and vomiting without medication. Hey there, I'm Dr. Nicole Calloway Rankins. I'm a board-certified OB GYN. I've been in practice for nearly 15 years. I've delivered over 1,000 babies and have helped thousands more women feel calm, confident, and empowered to have a beautiful pregnancy and birth. Nausea and vomiting in pregnancy is pretty common, and what I see a lot of providers do is jump straight into medications right off the bat. I know I was certainly guilty of that when I was in the office practicing prenatal care. However, there are many things that you can try that are not medication, and you may not need any medication at all. So let's get into 5 ways to treat nausea and vomiting in pregnancy without medication. Tip number 1 is to stop thinking of it as morning sickness. Yes, it can be worse in the morning, but nausea and vomiting in pregnancy can actually happen any time of day or night. When you realize that and accept that, then you're better prepared to deal with it when it happens. Tip number 2 is to change the way you eat. There isn't a lot of scientific evidence that changing your diet will necessarily help nausea and vomiting in pregnancy, but in my 15 years of experience, it definitely helps. So what you want to do is, instead of eating 3 large meals a day, you want to break it down into several small meals every couple hours during the day. This helps prevent your stomach from feeling too empty or too full. Both extremes can make nausea and vomiting worse. Tip number 3 is to eat more protein. At least one study has shown that protein is better for nausea and vomiting in pregnancy. So instead of eating things like crackers, stick with foods that are protein rich, like almonds, eggs, beans, Greek yogurt, or lean chicken or turkey. Tip number 4 is ginger. Ginger has definitely been shown to help with nausea in pregnancy. It's not as good with vomiting, but definitely helps with nausea. You can do ginger lollipops, ginger chews, ginger tea. You can do ginger ale. Pro tip though with the ginger ale, open it up and let it get a little bit flat, because those carbonated bubbles can actually make nausea and vomiting worse. And then the final tip, tip number 5, is acupuncture or acupressure wristbands worn at the P6 point on the wrist can actually help with nausea and vomiting in pregnancy. The studies are a little bit conflicting. Some studies show that it helps, some studies show that it doesn't, but it is a very low risk and easy thing to try, so definitely worth giving it a shot. Now, if you want to know more about nausea and vomiting in pregnancy, including what to do if these methods don't work, then check out my top-rated podcast all about pregnancy and birth. With nearly 250,000 downloads, it is a go-to source for comprehensive, evidence-based, holistic information about pregnancy and birth. You can check out my podcast at my website, ncrcoaching.com/podcast, or it's available on all the major podcast platforms.